Hi, this is Dave Shern. Welcome to News from National for January 2012. Today I just wanted to briefly highlight some of the issues that we've been working on nationally. The first two have to do with policy-related issues, and the second two have to do with public education materials that are available now or are soon going to be available. On the policy front, we've done a lot of work over the last several months on the federal budget, and as always, a principal concern of ours has been the budget for SAMHSA. There were some proposals out of the House of Representatives that would have dramatically impacted SAMHSA, and specifically the Center for Mental Health Services. And owing to our work and the work of all of our colleagues, we were able to get those cuts reversed. And although SAMHSA did see a small decrease in its overall budget, it wasn't nearly as draconian as was initially possible, and so we feel reasonably satisfied with how that turned out. That being said, we know that we've got a lot of work left to do given the current fiscal climate in Washington on budget-related matters. Second thing I'd like to highlight is the release of the Health and Human Services plan for establishing the essential health benefit. And as many of you are probably aware, the department has really delegated to the states with some requirements with regard to the elements that have to be included in the benefit structure. They've delegated to the states the task of selecting what will be the essential benefit in the state exchanges, which are going to be the insurance products that are available to individuals and small groups. Mental health and substance abuse services are one of the key components, so they will be there in one way or another. But given the fact that the states appear to be the locus of decision-making with regard to this, and given the fact that some of the federal policies, like only requiring one prescription medication in each of the major classes, present important concerns for us in terms of the accessibility of mental health and addiction services for people around the country. So pay attention to that. We'll be sending out very soon an email message to the affiliates through our advocacy network, information about the essential health benefits, so watch out for that. On the public education front, we have two products I'd like to talk about quickly. The first is a new website that will be coming up in February in the next few weeks, and that focuses on shared decision making. It provides specific concrete examples through some video performances of what can be expected in and through shared decision making, and I think you'll find it very exciting. This is an area that really resonates with MHA's history and our concerns. We have been working with Dartmouth and others on shared decision-making technology, and I hope this is something that really becomes a signature program for us. So take a look at that new website. And then finally, through the last year, we had a very productive partnership with the National Association of State Mental Health Program Directors and with Vanguard Communications in taking a pretty deep dive into issues related to primary prevention and a close look at what have traditionally been different perspectives represented by the mental health community and the substance prevention, the substance use prevention community, and have produced some very nice products which are on the website on primary prevention and a national agenda for it. I recommend those to you. They talk a lot about the compelling case given the state of our society and our culture, a theme that we hear a lot from recently. It was in the President's State of the Union address even last night, and the importance of building human capital and the critical nature of communities as the agents that will ultimately be responsible for making sure that the scientific technologies we have available become generally available and implemented with quality. It's another historical legacy of the MHAs to have a focus on public health and a focus on prevention. And these documents, I hope, will be very helpful to you and will provide a platform for us to kick off a series of community-based activities around building and strengthening the role of MHAs and other community coalitions as leaders in trying to assure the success of our human capital. So we've been busy here, enjoying a very mild winter in our nation's capital, and I look forward to talking to you next month.